Did you know that hearing sudden voices, tones, or buzzing, when no sound is actually there, can be a sign of a rare genetic epilepsy? People with this condition often experience auditory auras, like phantom sounds or ringing, sometimes followed by seizures. In most cases, these episodes are mild and infrequent, but they can deeply affect quality of life. This condition is called autosomal dominant lateral temporal lobe epilepsy, or ADLTE. It's linked to the lateral temporal lobe, which processes sound and speech. It's a rare genetic epilepsy, often caused by mutations in the LGI1 or RELN genes. Many patients respond well to their first anti-seizure medication, but others, especially those with a RELN mutation, may need a combination of treatments to reduce symptoms. Advanced brain imaging sometimes shows network abnormalities, even when MRIs look normal. Subscribe for more videos on different seizure types, and help raise awareness about the many faces of epilepsy.